Another thing that I think is really cool, this is a lady about a year out from fat, didn't do anything for the skin. Look at that malar bag, a little bit better. Look at the skin wrinkles and texture. I didn't do anything for it. The fat began to shut it down. And this is pretty consistent. About 80% of my patients report improvement in that texture and tone of the skin over a year. This is a lady that came to me after skin muscle lower eyelids with rounding of the eyes and very depressed of the hollowness. So I blended her. Now this is interesting. Look at her upper eyelid brow. This is actually 1 year and 2 weeks out. And if you look at the upper eyelid brow, it's a very heavy Neanderthal brow. And I didn't do anything to that area. I just filled the cheek and lower eyelid, and that makes the brow disappear from your eyes. It's sculpting it, and you're going to acquire some of that artistry as you begin to do this and see how you can actually balance it. That's what's so fun about this. It's not a mechanical, technical exercise. Over time, as you get to love this, you start seeing the artistry behind it. And that's, by the way, no makeup on, no foundation or anything on the after. There's just so much more light that bounces off a face with fat. A lady with acne scarring. If you look at her 9 months out, there's an improvement in the texture tone of the skin with no treatments except fat. I don't do body work, but I do hands to balance out the face. And you can see there's a nice change in that hand to balance. Everyone says, don't make me look too young because it won't match my hands. The hands give me away. Well, you can balance the hands with a face. So the summary is, don't forget volume. In my opinion, it's a key understanding of the aging process that we've overlooked. And we can combine it with facelifts and other things. Just be conservative when you're starting out. And think about that inferior upper rim not as a frightening area, because it's very easy to do, but just stay consistent and do a perpendicular orientation toward it with microdroplets in a superperiosteal plane. Thank you.